Hello, future nurses. This is Nurse Ed Scholar, and today we are going to dive into the fundamental topic of fluid and electrolytes, focusing on body fluids. Um, our body fluids is I guess, lifeblood of our bodies, and it keeps everything in balance. So, why are body fluids so crucial? They play a vital role in transporting nutrients to our cells and carry away waste products. So, imagine them as the body's delivery system, kind of making sure that everything reaches its destination and nothing stays where it shouldn't. Um, let's see, numbers. So the total body fluid, including intracellular and extracellular, makes up about 60% of the body weight in adults. However, this percentage changes to about 55% in older adults and 80% in infants. Now, why does this matter? Um, it means that infants and older adults are at higher risk of fluid related issues, problems, concerns. And children, if you notice, you see they have more body water than adults, while older adults have the least amount of body water. So that's why you really want to make sure that you assess well any kind of fluid related issues. Okay. So let's see what makes up these body fluids. And if you found this information, interesting so far, give it a thumbs up. So let's kind of keep moving. Now, um, you know, there's a dynamic mixture that kind of keeps our body running smoothly. So our body fluid consists of water and dissolved substances. Water, you know, the most, the most of it is water. So water, takes the lead. It's the largest single fluid in the body, but it does not travel throughout the body by itself. It brings dissolved substances that, plays a crucial part in our how our bodies function. Now, some substances like glucose, urea, and creatinine doesn't dissociate in solution. So that really means that glucose, urea, and creatinine, they don't break down into simpler substances when they are in a solution. Now, on the other hand, substance like sodium chloride, um, they dissociate. And that means that they separate in two parts when in a solution. Okay. Now remember, we said something earlier, we have to really make sure that we monitor infants and older adults for fluid imbalances. The variations in body water percentages make them more susceptible. So as new nurses, you really want to be vigilant in assessing this. So that's why, you want to make sure, you hear how you know that in infants, 80% of their body is water. So dehydration will definitely affect them. And then with older individuals, 55% of their body is made up of water. So as a nurse, remember when we are running fluids in them, older adults meaning, that you really want to make sure that you assess their breath sounds because too much water is going to cause them, they may have shortness of breath, and then you'll be assessing for crackles. So that's why, we're talking about why it's very important to know your patients, know the percentages of water, and then how it's going to be affected by the body fluid. All right, let's keep moving. So, body fluids, um, they transport nutrients. They ensure that every cell gets what it needs. And it also acts as like a cleanup crew, carrying away, waste products. Um, and so that's why, you really want to make sure that, one, that the patient has enough, body fluids to transport what it needs. And then also make sure that it removes what shouldn't be there. And that's the main role of body fluids, okay? Um, and that basically sums it up. Very short overview, kind of giving you an understanding of what you need. Um, we kind of looked at those percentages, and those percentages are very important in relation to body fluids. Um, what makes up the body fluid? Why is it important? About monitoring for vulnerable populations. We kind of talked about those infants briefly, and we talked about that older adult and those IV fluids. So as you embark on your nursing journey, try to remember and grasp these fundamental concepts. It really sets the stage for your future practice. Okay. And so if you found this helpful, don't forget to, hit that like button, share, um, subscribe. And like I said, these are just really small videos, so you can kind of digest a little bit at a time to really help on your nursing journey. So keep learning, keep caring for those patients out there, and until next time, happy nursing.